So welcome to the Power 92 Instagram page. My name is Mayha, and I feel like we may have talked once before, but I'm not really sure. I do know you. You're Dr. Candice Robinson, Medical Director of Chicago Department of Public Health. Thank you for joining us.
Yes, happy to be here.
So the vaccine is out, and there's a gazillion and one questions, not even just on my end. When I was actually telling somebody that I was going to speak to you about it today, they was like, oh, no, I'm not getting that. I'm not doing that. And I was like, good. You are the person that needs to tune in. You are the person that needs to tune in. So first and foremost, what is coronavirus looking like right now in Chicago? Like, what is the state of coronavirus right now?
Yeah. So the good news is coronavirus in Chicago, our case numbers are actually going down. And so our case numbers are going down. The percent of positive cases that we're seeing, which is basically the percent of people who tested positive out of everybody who got a COVID test that week, is all going down. So that's the good news. We're headed in the right direction. But I want to stress that, you know, we are headed in the right direction, but we can't let our guards down. Now is not the time to get comfortable and get laxed. We still need to do everything that we need to do to protect ourselves against COVID. We still need to wear our masks. We still need to social distance. We still need to wash our hands. And when I say wear your mask, over your nose and mouth. See a lot of masks over mouth and not over nose. So we still need to follow kind of all of the public health guidance to keep us going in the right direction.
Absolutely. And I love that you bring that up, because I was just about to ask, you know, for the people who know for sure that they want to opt out of this, how can they continue to, you know, help stop the spread? And you said it yourself, there's tons of people, and I see them all day, every day, without their mask over their nose. So thank you for sharing that part. But let's talk about these vaccines. We just seen Mayor Lori Lightfoot take her first dose, and people didn't even know that there were two. And some people are under the impression, I'm not really sure if this is the case, but are there multiple different kinds, or is there just one COVID-19 vaccine?
So there are multiple kinds. So right now we have two different COVID vaccines that are authorized for use. There's a vaccine by Pfizer and a vaccine by Moderna. But there are also more vaccines that are under study and that can come out here in the coming months or, you know, throughout the year. So there will ultimately likely be, you know, multiple kinds of COVID-19 vaccine available. But right now we just have the two.
So what is in it? People are like, is there water in there? What is it? You know, there's so many myths versus the facts. So let's start with that. What is in it? And how did this happen so fast?
So, that's two good questions. So first of all, I think the two vaccines that we have available now are both what we call mRNA vaccines or messenger RNA vaccines. And those vaccines basically kind of contain this mRNA, this little piece of information that kind of goes into our cells, teaches us how to make a small piece of the coronavirus protein that's on the outside so that we can recognize it and defeat it the next time we see it. So if you've ever seen COVID, it's kind of like that ball with like the spikes all around it. Those spikes around it are called spike proteins. And those are really important because they help the virus get into our cells and help the virus make us sick. And so what the vaccine does is it teaches our body, you know, how to recognize this protein. And so that way, when we see it, we can defeat it and, you know, not get COVID kind of.
So what does the first one do that the second one doesn't, that makes it so necessary to get that second dose?
Yeah, so for both of the vaccines that are out right now, you're right. They require 2 doses. And here's why. The vaccines are about 95% effective if you get both doses. But for the Pfizer vaccine, for example, after the first dose in the studies, it was only about 52% effective after the first dose. And then after the second dose, it was about 95% effective. And so to get the most protection that vaccine can give you, you really need both of those doses. So you can get up to that, closer to that 95%.
Now, I don't want to ask you, because I don't want to be in your business, if you got it or not. But I'm sure you know people who have, just as I do. And we want to know what it feels like, okay? What does it feel like?
Yeah, so as a healthcare provider, I was part of phase 1A, or the first group to get vaccinated. And so I have
Yes.
been vaccinated. I got both
Okay.
doses myself. I had arm soreness and some swelling after the first dose, very mild, went away on its own in a couple of days. And, those are side effects that can happen after the vaccine, some local swelling. Some people report some fever or chills, and all those are just signs that the immune system is working. Your immune system is saying, hey, I'm learning how to defeat that. That's not supposed to be here.
Yeah.
How do I get that out? But I myself had some pain at the site, swelling, went away on its own.
Okay,
in a
I
couple
had
of
a
days.
friend who said that it felt like Mike Tyson punched her in the arm. I was like, okay, that's intense. But she's a nurse. She was one of the people, say, what are the differences between phase 1A, 1B, and what is it, 1C? Talk about that, because where does she fall if she's a nurse?
Yeah. If she's a nurse, so the phases are really who's recommended to receive vaccine at what time. So we started here in Chicago with phase 1A back in December. And that included healthcare workers, like your friend who's the nurse, pretty much anyone in the hospital working or in clinics working. All of those people are kind of considered healthcare personnel, and they were recommended for vaccination. And we also recommended vaccination for our persons living in long-term care facilities. So our elderly friends, family members who are in the nursing homes and assisted living facilities, they were recommended to receive the vaccine too. As of Monday, Chicago moved into what we call phase 1B. And in phase 1B, Chicagoans over 65 and older are recommended to receive the vaccine, as well as some frontline essential workers. So this includes our first responders, our teachers, grocery store workers, postal workers, and a few other categories are all recommended to receive the vaccine in phase 1B.
Is there like a phase 1D where that's just the rest of?
So there's a phase 1C. And so for phase 1C, the CDC has recommended that for that phase, it will be anybody 16 through 50 or 64, that's the group we haven't hit yet, who have underlying conditions or underlying medical conditions, as well as the other essential workers will also fall into that category.
Okay, so I'm seeing someone here ask a really good question. They said, do you have to take the vaccine every year?
So that's a good question, and that's something we don't fully know yet. We don't exactly know how long the protection from the vaccine will last. Thus far, studies have been good that the people who got the vaccine as part of the trials have still shown to be protected. But that's something we're going to learn over time, and we'll continue to study to find out the answer to that.
I love that. Somebody is asking, this is a good question, how do you know which one to get, Moderna or Pfizer? Which one, how do you know?
Yeah. So right now, the vaccine supply is really limited. So which one you get will probably be which one your provider has. There is no preference for one vaccine over the other. Both are recommended, no preference for one over the other. I think the important thing is if it's your turn and you have the opportunity to get vaccinated, that you get vaccinated because you want that protection as soon as you can get that protection.
So essentially the only difference is the company that produced the actual, kind of like the Tylenol versus Advil, kind of maybe.
Sort of, yeah. They're just produced by different manufacturers, but they both work the same. They're both these messenger RNA or mRNA vaccines. They both have really high, what we call efficacy, or how well they work. Pfizer's, over 94%. Moderna's 94%. Pfizer's 95%. That's the same. No preference.
Everyone, I didn't even need to write questions because the ones that people are asking in here are so good. Does someone need a medical note, some proof that they're at risk before actually getting the vaccine?
Yeah, so we do ask that people kind of get vaccinated according to the phase that they're in. So if you are not somebody who's supposed to be vaccinated under phase 1A or phase 1B, we ask that you wait until it's your phase to be vaccinated. A good place to find out kind of all the phases and who fits under which phase is the Chicago Department of Public Health website. So that's chicago.gov/COVID vax. And then in most places, you just have to kind of attest, are you part of this group? And so you really want to make sure that we're vaccinating the people who are recommended to receive vaccine at this time.
Okay. So for the people who want to get the vaccine, after they get it, is there any chance that they can say that they had COVID-19 before the vaccine, got the vaccine? Is there a chance that they can still get it again? Or even after they get vaccinated,
if you can get COVID-19,
is it a chance to get it still?
So again, the vaccine is 95% effective. So it's not 100% effective. No vaccine that we have is 100% effective. But the way they show that is basically in the clinical trials, they give some people the vaccine and they give some people what we call a placebo. Meaning they didn't get the vaccine, they basically just got like a saltwater shot. They didn't get the vaccine, none of that. And what they do is they look at how many cases or how many people got COVID in that placebo group versus how many people got COVID in the vaccine group. And if you ever look at those tables, you'll see in the placebo group, those people continued to get COVID at a higher rate. Whereas the people who got the vaccine, there were still some who got COVID after getting the vaccine, but it was a much, much lower rate than the people who did not get the vaccine and who got the placebo. So no vaccine that we have is 100% effective, but that 95% efficacy definitely provides,
Does the vaccine cancel out the need to continue wearing masks?
No, great question. The vaccine does not cancel out the need to wear masks. So even after you are vaccinated, it's still recommended that you wear masks, that you social distance, that you wash your hands until we get enough people vaccinated and until the virus comes down and is under control. We need everybody to still continue to follow all the public health guidance.
When are we going to get rid of this thing?
I hope soon, but the way we get rid of it is by all of these actions, by following our social distancing, wearing our masks, getting the information that you need so that you can feel confident getting the vaccine when it's your turn, and using all of these tools are really going to be what helps us get out of this.
Now, is the process of actually getting signed up and actually getting there and actually getting the shot, what is that process like?
Yeah, so I think it'll vary by where people get their vaccine. There'll be, multiple places where people get their vaccine when it's their turn. So first I should note, right now, vaccine supply is very limited. And now that we're in 1B, there are a lot more people who want the vaccine than we have vaccine available. So we do ask everybody, to be patient. Right now, in some cases, medical providers are reaching out to their patients who fit into the 1B category. So in some cases, people are getting calls from their doctors. We have vaccine clinic sites for the city of Chicago. Right now, they're still primarily focused on 1A. We still have some healthcare workers that are getting vaccinated, but we will be bringing in, 1B into those settings soon. So stay tuned to the website for that information. Another place where people get vaccines are pharmacies. Again, those appointments are going really fast because more want the vaccine than we have available right now. But stay tuned to that website, because that website, that Chicago Department of Public Health COVID vaccine website, will be where all of your information.
So, thank you for sharing that, all that information. Really, I'm still obviously seeing a lot of skepticism in the comments. The real Giz, she says, so what is the point of getting the vaccine if you can still get the virus? And I'm assuming it's something similar to, the flu vaccine. You're
Right.
It's almost, to me, it's the same thing. Is it?
Yeah. So, the point is you're protecting yourself. The number of cases in the group who got the placebo versus those who got the vaccine were far more. And so you are protecting yourself. You are lowering your risk of getting the vaccine, of getting the virus by getting the vaccine. And so that protection is important. And, there's also been some evidence that the vaccine, even if you get COVID, it may lessen the severity of COVID if you get it. And so this vaccine is affording you protection, more protection on top of your mask wearing, on top of your social distancing. All of these tools are needed to really protect ourselves.
I know a lot of people who are immunocompromised. And I know a lot of times when you take medication, sometimes it can counteract with other things. So is that something, people who are diabetic or got congestive heart failure, do they have to worry about certain side effects from the vaccine?
Now, all those persons, the diabetics, persons with heart conditions, that is not a contraindication to vaccination. It means they can still be vaccinated. And in fact, part of 1C will be specifically vaccine for people who have conditions that put them at higher risk for severe disease, again, COVID disease. So, you want to make sure, particularly if you have one of those conditions, that you are getting the information and you're ready to be vaccinated, because that protects you as well. And if you have a higher risk or one of those conditions that put you at higher risk for severe disease, that protection becomes even more important.
Well, I do want to go through some of these myths versus facts, because I put an asterisk next to the ones that I hear the most. And one of them, which we sort of talked about a little bit earlier, is how is it that a vaccine got created so quick? How did these people that got tested, where did they even come from? How did you even know that you can go be a test person for this? Like, can you help clear that up a little bit?
Yeah, sure. So I hear that a lot too. How did this vaccine come up so quick? Was it rushed, et cetera? And so I think it's important to note, while this mRNA vaccine technology is new in vaccines, it's not a new technology. This is something that scientists have been studying for over a decade. And I think it's also important to note that they completed all 3 steps of the clinical trial. So clinical trials happen in what we call phases. In each phase of the clinical trials, they're looking at different things, and those really run off of volunteers. You can actually go to a website. There are websites here that are, recruiting for other participants for vaccine trials, even now in Chicago. And so the volunteers basically sign up to be a part of these vaccine studies. They receive the vaccine, and then they follow up with the researchers, and that's how they determine, who gets placebo, how well it works, et cetera.
All right. I'm seeing, the vaccine itself, people are afraid that it will indeed give them COVID-19.
Yeah, that's something we hear often, and that is not true. The vaccine does not contain the live virus, doesn't contain dead virus. It can't make the virus. The vaccine cannot give you COVID-19.
I've already had COVID-19. I don't need the vaccine.
Yeah, so there are cases where people have been reinfected with COVID-19. And we also don't know how long your protection lasts after you get COVID-19. So because there have been cases of reinfection after COVID-19, it's still recommended that you receive the
what
vaccine.
is one of the biggest ones that you have heard so far?
I think those are kind of some of the big ones. I think another one I hear, I'm healthy. I don't need the vaccine. I'm healthy. I work out. I eat great. I can't get COVID. And that's a myth. You can't. COVID doesn't stop and see what we're eating before it decides whether or not to infect us, right? So I think it's important to note that even if you don't have underlying conditions, even if you eat healthy, even if you exercise, you can still get COVID, and you can still have serious disease or end up in the hospital or worse.
Absolutely. Thank you for sharing all this information. Do you have any more time to take some of these questions in here, or do you have to wrap up? Because I know you have a couple more.
I do have a couple more, but we maybe one or two more questions, and then we'll wrap up.
Let's see. I've been protecting myself because I'm in healthcare and my mom has cancer, but I still don't trust it because I've seen it affect people after the first dose. So people are asking, can they really trust this, essentially?
I like to say, I believe in the science. The science has shown, the studies have shown it's safe and effective. I don't just lead by science, I lead by example. I trust the vaccine. I was vaccinated. My grandmother, who lives, in a senior living place, was also vaccinated, and so I trust it for myself. I trust it for my own grandmother. And so I think the science has really shown, that the vaccine is safe.
You've kind of put me at ease too, because I'm one of the people who's somewhere down the middle. I do have a super immunocompromised father, so I'm asking questions from a personal place too, like what can we do, because we don't really know. Someone continues to ask about cashiers. Are they considered in group B?
Yeah, so grocery store workers, anybody working in the grocery store, anybody working in feeding. So that includes your cashiers, your baggers, stock persons, persons working in food pantries, all of those are included in 1B. And the Chicago Department of Public Health website has it all listed out for you, so you can point to it.
Yes,
so here I am.
Dr. Candice Robinson with all the 411. I hope she has put you guys at ease in some capacity. I see lots of people are optimistic, but then there's, you know, the skeptical people too. So thank you so much for taking the time out and actually explaining it and really breaking it down for us.
Thank you for having me. And go to the website, everybody. Learn more about this information and more questions.
Thank you again. You guys can also follow Shy Public Health as well. And protect yourselves. Protect yourselves. Thank you again. All right. See ya. Take care.
Bye.